Now, here's our reporter Laura Windsor with some interesting insights into LASIK procedures.
Laser vision correction has become very precise and is able to be customized for each patient. We spoke with Dr. Alan Berg, who will discuss the many options for people who want to improve their vision.
We have we consider the most advanced technologies in laser vision correction. There are really two lasers that are used to perform the LASIK procedure. The first one is called the intralaser, and it's a laser which actually creates the flap. That's the first part of the laser vision correction. We create a flap in the cornea. It's all done now with laser technology. The laser is much more precise and accurate, and actually we can now create very thin, accurate flaps and do patients who couldn't be done in the past. The second part of the procedure, once we've created the flap, is to then laser the cornea to basically reshape it, and that's done with the Vizx excimer laser. It's called the Vizx S4 active track laser, and this laser uses what's called customized or wavefront technology to change the shape of the cornea to eliminate the patient's need for contacts or glasses. The advantage of this technology, it's basically astrophysics technology fashioned after the Hubble telescope. And what it does, it eliminates all the refractive errors within the patient's eye and gives the patient the ability to see better than 20/20 in many cases. The second thing it actually does is that prior to this technology, patients would occasionally complain of halos or glare at night, and that was an after effect of the laser vision correction. And the wavefront technology has taken that and basically embraced it and eliminated the side effects of halos or glare at night by using this technology.
I was wearing glasses before, and then I didn't like those, so I tried contacts, and then those were just more irritating than convenient. You know, can't see in the morning, have to go run, basically put your eyes in before you start the day. So I thought this, you know, more cost-effective and more beneficial than glasses or contacts. I can see the alarm clock. I don't have to go, you know, run into the bathroom, get my contacts, put them in, and then say, oh, okay, now I can see everything. Highly recommend LASIK, highly recommend Dr. Berg.
For patients who have been told in the past they're not a candidate for laser vision correction, we have other technologies now which we can offer these patients, such as implants. And these patients who have been told in the past they couldn't have refractive surgery can now have other procedures which can solve their refractive problems and again make them glass free.
I had mine done approximately 6 months after working here at this practice, and it's been phenomenal. My vision is 20/10 and can't get any better than that.
The surgery was very quick. I don't think it took longer than 15-30 minutes. So that was nice. And then afterwards they put like goggles on, or not goggles, but a mask on your eyes so you can't scratch them. And you go home and go to sleep for 5 hours, and you wake up and a whole new lifestyle you could see. And I remember I could actually drive during the night and not need glasses or anything that same day. So it was wonderful.
The technology has just gotten much more precise and actually much more advanced, such that we can give patients much better results, and the bar has risen considerably. Patients used to be happy with just passing their driving test with 20/40 vision. Now we're looking for 20/20 and beyond vision, and we're able to obtain that with the advances in laser vision technology.
Up next, we'll see how two vision professionals work together to benefit their patients. We continue now with optometrist Dr. Barry Leonard, who explains how he works with ophthalmologists like Dr. Alan Berg to get each patient the best vision possible.
As a doctor of optometry and an OD, basically I feel that we're the family doctor for the eyes. We're, you know, like you think about in the old days, we're the general practitioner, the family doctor. We're going to do that complete evaluation of your eye health and your vision system and treat it in any one of different ways. Most likely people think the first thing they think of eyeglasses because there they are sitting on your face. There's eyeglasses and there's contact lenses, and then there's a myriad of different surgical procedures now to correct vision or for diseases that we find in the eyes. So our job is to take care of those things as an optometrist and find what the best solution for that particular patient's and vision needs are. Co-managing with my patients does work extremely well in that they know that I, as their primary eye care provider, can choose, you know, who for that particular reason who they should, the best person qualified for them to see, and then I can help direct them.
When we co-manage a patient with their referring optometrist, we think gives the patient and us the advantage of knowing more about the patient. Their optometrist has taken care of them for years. They know their history. They know the patient better than we will ever get to know the patient. So it gives us an advantage by working with that optometrist, I think, to do a better job for our patients. For many patients, they come from a far distance, and by working with their optometrist, it's more convenient. I think they feel more at ease because they've learned to trust their optometrist. The patient has worked with their optometrist for years. They have faith in their optometrist, and their optometrist can help guide them along through the procedure. Plus, in many cases, these patients come from long distances, and it's much more convenient to work with their optometrist.
Especially with working with Dr. Berg. Someone of his caliber is just that. He makes sure that you are in control, that it is my patient, and that I know exactly what's happening at all steps, and he's consulting with me as I consult with him to make sure that we get the end product that we want.
Co-management is a combination. The patient is not only referred to our office for care, but the optometrist is an integral part of the patient's both pre- and post-operative care. So I think we get the best of both worlds. We get all the information, we get the advantage for the patient that their optometrist, who knows them very well, can help direct the appropriate care and the appropriate procedure, and the patient then, I think, gets the procedure that's best for them.
As your optometrist, as the optometrist for my patients, again, our practice is this month celebrating 50 years in existence in this community, and over that time we've developed a team of surgeons and facilities around us to find the best one. With LASIK in particular, it's become a commodity more than a surgical procedure, and to find the surgeon that has the skills and the best judgment of what is going to be best for my patient is very, very important. It's not something that you can say, hey, that's, it shouldn't be price driven, it shouldn't be that. It's really the skill and the expertise and the judgment of the team to make it come out right.
With the advances in ophthalmology, there are now many options for people to see without glasses or contacts. I'm Laura Windsor for the American Health Journal.